No be me do more. No be me do all of the progress when you see in my life. No be me do no be me do
Hello lovely people, welcome to Aneeja Hospital. I am Sally Asamoah. As part of World Asthma Day, I have with me here Dr. Korsah, a general practitioner at Aneeja Hospital, who will be educating us on what asthma is. Hello Dr. Korsah.
Hi Sally.
How are you doing, Doc?
Doing well, how are you?
I'm fine, thank you. Doc, thank you for joining us today as we commemorate World Asthma Day at Aneeja Hospital, and we're excited to hear from you. And we would want to know what exactly asthma is, if you could do a little explanation on it for our viewers.
Okay, thank you for having me. So basically, asthma is a chronic condition, basically affecting the airway and the lungs. Yes, so when you have certain triggers coming in, you have difficulty in breathing, sometimes coughing, chest tightness, and some other symptoms that are associated with it, just because your airway has been narrowed because you came into contact with a certain trigger, or you even have certain risk factors that predispose you to having that particular disorder. So it's basically a chronic disease where there's associated inflammation of the airway resulting in some form of respiratory difficulties.
Thank you very much, Doctor. So for now, some of us do not know, or we are not familiar with what some of the signs and symptoms are. So if you could quickly give us some signs and symptoms, or what are some of the things we can look out for in a person who has asthma?
Alright, so for people who have asthma, you don't just walk around and have the symptoms. Usually these symptoms occur when you have an acute episode, or you have something causing a trigger, and then you have the symptoms you're talking about. So most commonly what we usually see is the wheezing. That is like the high-pitched sound that people make when they're breathing. You see their chest moving up and down. They're literally struggling to get in air into their bodies. So that's one of the most common symptoms we have. Some also come with coughing. They will cough so much. Other people will have this chest tightness that accompanies either the coughing, the wheezing, or the difficulty in breathing. And even some cases, in some extreme cases, the person can come with blue lips or dark fingertips. That means the oxygen deprivation has been so bad, the person is literally struggling to breathe.
Wow.
And then in our part of the world where we are dark, those things might be a little bit difficult to see, but you can still see them from some of the mucous membranes that's
So doctor, if I may ask, is asthma curable? And if not, are there any effective ways to manage it?
Okay, so asthma is a condition that can be managed. Yes, if you have asthma, there's still hope for you. It's not like all hope is lost for you. Yes, and then as it stands now, there's no, I wouldn't say there's a cure. Even though in some instances some people can go into remission, that means they wouldn't have any acute episodes for a very long time. There is no cure per se for asthma, but then there are medications and other lifestyle modifications and things that can be used to manage the condition.
Finally, Doc, what advice would you give to the general public, especially with those who have asthma and then those who are caring for asthma patients?
So although asthma is, it can be a serious condition, it is very manageable. You would first of all have to speak to your healthcare providers for them to give you the required medications that you need to take. Try and avoid the triggers that cause the acute episodes, the cold weathers, the grass and other things that you have identified that cause yours. And also use your inhalers or whatever medication you have been given as you are supposed to, and you can live a normal life like anybody else.
Sure. Thank you very much, Dr. Korsah, for this insightful explanation, and we hope this information empowers people out there so that they can recognize and manage asthma effectively. Happy World Asthma Day.
Man, I go looking at the face. Speed me and speed up and I increase the pace. Whatever God give, nobody can replace. Nobody can just see a brand new